this is Debbie Carberry and welcome back to my YouTube channel. Today I want to talk to you about the most common referral I receive for adults, and that is clients presenting with anxiety and depression. Clients will come to me and say, I feel anxious, I feel depressed. And sometimes it's because of a chemical imbalance. Those imbalances need to be treated by a GP, and then perhaps psychotherapy can help. However, when some people come to me with anxiety and depression, it's in relation to a really normal situation that's occurred in their life. For example, they may have lost a partner, a friend, or a family member. They may be going through a divorce or separation. It's possible that they could be having some low mood or worry about job loss, finances, and these are really normal situations that many people will go through in their lives. During those particular times, I try and help people understand that low mood and worry are part of the way we live. And in our society, we're not encouraged to live with these things. We're encouraged to get rid of them, not feel discomfort and pain, and try and move forward without feeling any of the natural feelings we would get from something that's really distressing for us. In my clinic, I try and help people understand about how they can manage this stage, which will eventually pass. If a partner dies or a relative dies, you're going to feel sad. Grief and loss can go on for an extended period of time, a year, 12 months, 18 months perhaps. And through those times, there's lots of different feelings that will come up, including feeling low and worrying about the future. I think one of the most interesting things about depression and anxiety is people get really fused with that. I use a therapy called acceptance and commitment therapy with clients, and we talk about fusion a lot, where people get anxious about being anxious or depressed about being depressed. And that can make it really difficult to manage. So it's the fusion that occurs that causes the problem, not necessarily the anxiety, the depression, or the low mood or the worry. It's the fact that it worries them that they worry. What I try and do with clients is help them to see their anxiety, depression, or low mood or worry from a different perspective, that it's in their life and it's present, but it doesn't have to be all-consuming. There are lots and lots and lots of things you can do if you are struggling with anxiety or depression. Getting exercise, we know, really helps. Making sure you get outside and get a little bit of D3 can really help. It's really important to spend time with friends and relatives and not become socially isolated. Setting a routine can be really helpful so that you make sure that you're doing the things you need to do every day. In addition to that, there are some fabulous things you can do around meditation, mindfulness, relaxation. All of those things can really help you manage a stage that you may be going through. In addition to that, of course, you should see a professional if your symptoms are persistent and won't go away. Medication sometimes is what's needed, but there are lots and lots and lots of things that you can do that are natural that will really help you lift your mood and help you cope with these very difficult times. In my clinic, I try and help people understand that the pain that they're feeling will pass, and if they can allow some space for it, if they can try and manage with it rather than trying to get away from it, that can be really helpful. Some of the other things they can do are go to a therapist and do some acceptance and commitment therapy or cognitive behavior therapy, which we know is really helpful for anxiety and depression. Anyway, that's all for today. If you have any questions, if you'd like to leave any comments, please do so up underneath the screen. I'll be back next time with more information on my clinic and some of the things I see every day. Thank you very much for coming. Bye.